Hi guys, this video is a super important video and I don't know why it's taken me so long to figure out that I should film it and why it's taken so long to record it. But here it is, better late than never. This is for anyone who is considering an in-office peel, microneedling, laser resurfacing, most in-office procedures, especially the deeper procedures, the deeper peels, the deeper laser resurfacing, not necessarily the clear and brilliance, but the Frexels, the halos, the CO2s. So if you or your friends are planning to get in-office procedures, watch this video, share this video with them, and don't forget to like and subscribe. What preconditioning means is getting your skin ready and strong before a procedure. Similar to going to the gym and working out before that marathon or that competition. The more you prepare and the more you work out, the better you are equipped to handle the competition and the less likely you are to injure yourself. And this is exactly the same way. The more you strengthen your skin and prepare it for a procedure, the more likely you will have an even better outcome and the lower the chance that you'll have an adverse event or an adverse reaction. In order to precondition your skin, you have to make it more resilient to induced insult, whether that's laser light, whether that's microneedles, or whether it's chemicals penetrating through the skin, attacking it, and as they chew it up and penetrate to deeper layers. In other words, a chemical peel. And strengthening the skin and preparing it for these acute insults basically means using a retinol or tretinoin for a certain amount of time before the procedure. And it depends on your skin tone and how prone you are to post-inflammatory hyperpigmentation. So the very fair types, Fitzpatrick 1 and 2, very white skin, blondish hair, the minimum amount of time that's required to prepare for an invasive procedure is roughly 4 to 6 weeks. Slightly darker skin tones that are more susceptible to post-inflammatory hyperpigmentation need to precondition for at least 8 weeks. And the skin tones that are most prone to post-inflammatory hyperpigmentation really need to precondition for up to 18 weeks before having a procedure. Now, 18 weeks sounds like a really long time, and it is a really long time, but if you want the optimal results and if you don't actually want to harm your skin, but you want to help it and take it to the next level in a positive direction, in some cases, you will need to precondition for 18 weeks. The way one would go about preconditioning the skin, to put it really simply, is to start using a minimum of a 0.5% retinol. However, not all retinols are made equally. Retinol is not a stable compound and different companies can make different retinols, and you never know if that percentage you're applying is really living up to that true value. So if you want to play it safe, the safest way would be to precondition with tretinoin, because you know tretinoin is tretinoin, and it's no matter what the company that makes it is, it's a pharmaceutical, so it's controlled and it's regulated. And if you get yourself a 0.05% tretinoin, your skin will develop a certain resilience to the treatment. So I would say a minimum 0.05% tretinoin, or if you have a retinol equivalent, the only ones I would trust for preconditioning the skin would be the retinol skin brightener from Zeo at 0.5% minimum, or the wrinkle and texture repair from Zeo. Otherwise, I would stick to tretinoin because it's tried and true, and with other formulations, you just don't know the value equivalent that you're getting. If you precondition your skin, you will be safer and your results will be that much better. What have I seen from pre-treating my patients? Well, I can tell you straight off the bat. If you've ever seen a microneedled face after the treatment, it's beet red. If someone is very well pre-treated, that redness calms down within minutes. Oftentimes, by the time they're leaving my office, they're not red anymore. Whereas if they're not pre-treated, that redness can linger for 24, 48 hours. It makes a tremendous difference. And when I see my patients over time, if they're on a high quality and a higher dose of a retinol long term, then their resilience to any kind of injury, whether it's thermal or, like I said, chemical or physical, like needles, is so much higher that they just recover instantly. And that way their skin focuses on healing from the injury by improving the skin rather than trying to scramble and repair it so that it doesn't scar or hyperpigment or get damaged. So it really is, like, a great analogy for this really is going to the gym and preparing for that race or that competition or that challenge, where if you're nice and fit and in shape and toned, you're less likely to hurt yourself and you're more likely to win. And this is exactly the same thing. So I wanted to put it out there. If you have any questions, feel free to leave them down below. At least if you're going to do procedures, at least start off with a retinol of any kind. Anything is better than nothing, to just minimize your risks and optimize your results. And know that if you're a darker skin tone, you're much more likely to experience adverse events than the fair skin tones, which are less likely naturally to hyperpigment. And if you are a fair skin tone and you're not sure if you would be more likely to hyperpigment or not, I have a cheat trick for you. Look at the palm of your hand, and if the lines on your hand are darker, then you're more likely to hyperpigment from post-inflammatory hyperpigmentation. If the lines in your hand, your palmar markings, are very light, then chances are you are not very much at risk for post-inflammatory hyperpigmentation. So that's just a little trick that I learned along the way, and I think is very useful. So I'm sharing it with you. Anyways, that's it for today's video. Don't forget to precondition your skin and protect it before procedures to have better outcomes. If you have any questions, leave them down below, and I'll see you guys in the next video.